Balance of Nature's fruits and vegetables in a capsule, changing the world one life at a time.
I've been taking Balance of Nature for 3 months, and man, let me tell you, it is fantastic. I sleep better, I have more energy, my mind is clearer. The trick is the way you guys process it. The nutritive value in the fruits and vegetables stays because you guys are not putting it under any heat. Dr. Howard is a wonderful human being, and sooner or later, the rest of the world is going to catch on to the good things that Balance of Nature is doing, and a lot of people will get on the bandwagon.
Get a wide variety of all your daily recommended servings of whole fruits and vegetables without having to leave your home. Right now, Balance of Nature is offering free shipping and 35% off on any new preferred order. Call 1-800-2468-751 or go to balanceofnature.com and use discount code Chicago.
Life is a marathon, not a sprint, unless you're hiring. Fortunately, Indeed has great tools that help speed up the hiring process. Visit Indeed.com/credit.
8:38, Team Hochberg Traffic Center time and Jim.
8094 westbound traffic is hitting the brakes from Burr to Indianapolis Boulevard. There was an earlier crash and there's some road work there. It's a 17-minute drive from the Indiana Toll Road to the Bishop Ford Freeway. East, it's 15 minutes. The inbound Kennedy, delays start at Cumberland. It's 27 minutes, so here to downtown. Express lanes save almost nothing at the moment. Outbound downtown to the airport is 24 minutes. The exit ramp to Montrose has reopened after weekend work. Inbound Eisenhower, 33 minutes, 390 to downtown, 21 from Wolf. Outbound, 26 minutes to 390. Stevenson, 28 minutes from the Veterans Memorial Tollway to Lakeshore Drive. The Ryan, 15 minutes, 95th to downtown. I-57, 11 minutes, I-80 to the Verge, Bishop 410. That's traffic. I'm Jim Talamonte on AM 560, The Answer.
Jim, thank you. Worried about basement flooding? It's time to call Permaseal, 800-421-SEAL. Chicago's Morning Answer continues next. In our AM 560 Weather Center, breezy, clouds and sunshine. We'll top out at 64. It's 50 right now at O'Hare. Next news at 9, and Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
From the Matrix Home Solutions studios, this is Chicago's Morning Answer on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, and your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Top of the morning, Dan, and in for Amy J this morning is John Anthony, host of Black and Right, Saturdays on these areas 1 to 3. And, John, you wanted to address something we were talking about with reparations right before the break.
Yeah, I mean, one of the things that I was talking about, and I don't think the lady was trying to listen to, there are a couple of groups out there when it comes to reparations. ADOS, American Descendants of Slavery, they believe that only people who can prove that their ancestors who were born here in America, they should get reparations. Then you have the Jim Crow crowd who believes if you can prove that Jim Crow negatively impacted you, you should be able to get reparations. And then there's the group that says everybody that's black should get it. Personally, I'm not a reparations guy, and I get a lot of beef and heat from it because, you know, I'm making my own way. I'm teaching my kids to make their own way as well, not to fall to this victimhood mentality.
Mm-hmm. Yeah, no, it's a discussion that will continue as more cities go the way of Evanston and Oakland, to be sure. All right, switching gears, pronouncements from a couple of doctors. One is the CDC director. Another is just an Idaho dermatopathologist named Ryan Cole. Let's start with him since he's less well known. Giving a little briefing locally on COVID-related matters there in Idaho.
Average COVID-19 death age, 78.6. Average age of death in North America every year, 78.6. That's fascinating. What are our highest risk factors? Obesity, low vitamin D levels, advanced age. 90% of deaths in the state have been over 70 years of age. That's the at-risk population. We have stopped our society for something that's taking people that are already at that death risk age anyway. The virus is fragile. These are just little tidbits. It's fragile. It doesn't live outside. UV light fractionates it, kills it, blows it apart. Ventilation in the wind blows it away. It is insanity to wear a mask outside. It is absolute insanity. And that's science. That's science. There is not one study that has shown any super spreader event to have occurred outside. They have all been indoors with poor ventilation.
Mm-hmm. Well, Dr. Rochelle Walensky is the CDC director, and she made an appeal yesterday, not as a CDC director. She took that hat off. She made an appeal, one human being to the other.
So I'm speaking today not necessarily as your CDC director, and not only as your CDC director, but as a wife, as a mother, as a daughter, to ask you to just please hold on a little while longer. I so badly want to be done. I know you all so badly want to be done. We are just almost there, but not quite yet. And so I'm asking you to just hold on a little longer, to get vaccinated when you can, so that all of those people that we all love will still be here when this pandemic ends.
Mm-hmm. The data and science people making an emotional appeal. Interesting. For a reaction to that and a discussion of where we currently sit with respect to the virus from his perspective as an expert as well. Pleased to be joined again by Dr. Marty Makary. He's a professor at Johns Hopkins School of Medicine and Bloomberg School of Public Health. He's chief medical advisor to Sesame Care and author of the award-winning The Price We Pay. Dr. Makary, thanks for joining us again. Appreciate it.
Great to be with you guys. You guys crack me up. I love it. You got to give it to Dr. Walensky, though. For at least for 30 seconds, she was not reading a speech that the White House wrote for her.
No, that was. She was putting on her human hat and just speaking one human being to the other. Except as the CDC director, I'm interested in what she has to say professionally. I'm not interested in emotional appeals to hang in there. You know, I have my kitten calendar at home with a kitten from a tree limb for that sort of inspiration. I don't need it from a scientist.
Where was she in last week of February of last year when a bunch of us were running around the country trying to warn people? I mean, it's like somebody who shows up late for a birthday party, you know, when everyone's left and you feel bad for them. They're bringing a bottle of wine. I mean, you cannot have massive increases at this point. You cannot have massive surges. Sure, you can have rolling increases, and we're seeing that in Michigan, mostly in the population age 0 to 19. Look, young people were just last in the vaccine line. They're more susceptible. And we're going to see the virus circulate in younger people, most of whom have no idea that they're sick or they have no symptoms. Some have mild infections. And for a few people, it's serious. I'm not telling people to just, you know, forget about the virus. It's still circulating. But the outlook is really good. And the idea that somehow you're going to pop back up, the deaths and hospitalizations are going to pop back up to where they were, it's not a stock price, okay? Every other person in a room now has immunity, and so it doesn't jump around like that anymore.
So, I mean, I don't want to necessarily get into imputing motives here, but I mean, concurrent with this, just hang on, hang in there, wait for us to give you the clear sign, is heightened conversation about vaccine passports. Are the two connected?
You know, I don't know if they're connected. I think that right now they're using fear and they're using it disproportionately, and I think they're misrepresenting the risk. Look, I can tell you as a doctor, if I really want to get somebody to do something, I just tell them, you could die, right? You scare them a little bit, and that's not fair. It's not honest, and I think right now the message that's being sent is not really an honest message. Yeah. Vaccine passports, yeah, we can chat about that. I've got some different thoughts on it.
Please share them.
Yeah, please.
Well, I think, you know, for a private entertainment or a restaurant gathering, if somebody wants to really pack people in there and they want to, you know, see that you've been vaccinated, I don't have a problem with that. If an airline wants to see that you've been vaccinated. The thing is, you can be immune without the vaccine. And what are we going to do about those folks? And I think if somebody's had the infection and they choose not to get the vaccine because they're already immune from prior infection, I respect that decision. It may turn out to be similar in terms of the immunity. We just don't have the data yet. So, you know, I have some mixed feelings about it.
So, Dr. Marty, I'm looking at the number of cases of flu from 2019 to 2021. Did the flu just mysteriously disappear, or could some of these cases that they're testing for COVID be actual flu cases?
I know the cross positivity of the testing is not there in any degree. So we just crushed flu this year. And I can tell you, why were we hearing from all these same CDC and Fauci folks about how the flu was could be bad, and it could be a so-called twin-demic. Remember the twin-demic? Like, we're going to collide with coronavirus and the flu. Look, I was saying we were going to have a bad fall. I mean, you can go out there every day. I was saying in the media, the fall is going to be bad. This is going to be worse. But it was not going to collide with flu and be this exponential, collision of subatomic particles. There was no flu, and we should have known that. Fauci and they should have known that, because in the Southern Hemisphere, we watch the flu before it comes to the U.S., and there was no flu in the Southern Hemisphere. So anyway, you're getting a lot of bad information.
Brian, going back to the vaccination issue, because of the double speak surrounding that, including from Fauci, but not limited to him, of course. Brian Kaplan, who's a George Mason University economist, wrote, "Fear me not, I got my COVID vaccine. I'm now fully vaccinated. How should I change my behavior? How should anyone?" And he quotes immunologist Alexander Sette saying, not taking any precautions, including wearing a face mask, practicing social distancing, or getting vaccinated after an initial coronavirus infection is comparable to driving a car where you're 90% sure the car has brakes. And Kaplan responds to that saying, both common sense and economic reason say virtually the opposite. If a risk falls by 90% and there are large gains to accepting the risk, you should not only accept more of the risk, you should probably accept much more risk. And the larger point, though, too, is, it's sort of the mask thing. If I still have to wear a mask, then why get the vaccine? If I still can infect, then how is my vaccine passport meaningful?
Look, the CDC is going to give you some convoluted algorithm where you go down a decision tree and if then and 6 feet and all this nonsense that they've put out there. Let me make it very simple, as I did in the Wall Street Journal recently.
Yeah.
Get your vaccine, you wait 4 weeks, and you live a normal life. It's that simple. You don't have any immune protection in the first 10 days, and you got to give it some time for the antibodies to kick in. But at 4 weeks, go live a normal life for the love of humanity. People are dying of social isolation. I mean, it kills people. I've seen it. And businesses are starving. So give it 4 weeks, live your life. For now, I'm asking people to continue wearing masks in public indoor gatherings for a little bit longer, just because it's too hard for businesses to enforce a partial selective mask mandate, but live your normal life. I mean, how have airlines been able to pack adults in there shoulder to shoulder during the whole pandemic with no super spreading on airlines? It's because you can do it, right, with ventilation and masking. And once you're immune, we've got to live your life a little bit. Look, if the question is, if I leave my home, can I get bacterial meningitis?
Right.
The answer is always going to be yes, right?
Yeah,
but
right.
At some point, the risk-benefit flips.
Yeah, that was Kaplan's point, too, about the vaccination. Just speaking of the impacts, this study out in terms of weight gain among populations, particularly millennials, a little bit younger, too. As you were saying, this is still making its way to younger people as they're last in queue to get vaccinated. Millennials as a group, 48% reported unwanted weight gain, with an average of 41 pounds. 42% of adults in the United States reported undesired weight gain with an average of 29 pounds. 29 for the 40% that reported undesired weight gain, and 41 for the 48%, almost half of millennials who reported unwanted weight gain. And yet here, again, obesity makes you more vulnerable to the virus, so what have we done?
People are depressed. Look at the rates of self-harm among kids, up 300% in the Northeast last year. I mean, we're seeing a mental illness crisis sweep across the United States. By the way, it was there before. It's magnified. In young folks, it manifests as severe mental illness, sometimes to the brink of harm and self-harm. And in older folks, it manifests as frailty and people actually having reduced physiologic reserves from being frail. So I think it's one manifestation of a bigger problem. I'm not looking forward to doing surgery on a more obese population when we get back into full elective surgery. I'll tell you that.
He is Dr. Marty Makary, professor at Johns Hopkins School of Medicine and Bloomberg School of Public Health. He's chief medical advisor to Sesame Care and author of the award-winning The Price We Pay. Dr. Makary, thanks for joining us. Keep the op-eds coming.